Hello there, Dr. Mike Quast with iChiro Clinics. Today I just want to do a quick video for you on how chiropractic can help ear infections. There's a lot of mystery around this, a lot of people confused about it, and it's really pretty simple once you understand how it works. And we see a lot of wonderful results with kids with ear infections and having that resolve. The first thing you got to see is some of the anatomy of how a ear is constructed. I just have a little picture here I'm going to show you so you can kind of see. This is a diagram of the ear, and what you're seeing here, you can see the eustachian tubes actually drain the middle ear, and that's what happens when you have a ear infection. Is these eustachian tubes become blocked, fluid builds up in the middle ear, and then it creates pressure and problems in there, and then bacteria come and eat the fluid, give off gases which create more pressure, and it can get infected. So this is the problem. You see the eustachian tube coming through there, and the key is to try to get that to become unblocked. Now obviously you can drill a hole in the eardrum, which is very extreme. A lot of people do get tubes put in. You can take antibiotics, which will kill the bacteria, but it still leaves that food, the water, infected fluid in there that the bacteria are going to want to eat, so they just come back. So if you have bout of this and you do antibiotics after antibiotics after antibiotics, it's because the fluid is still not draining out. And what we found is that when you look at the eustachian tube, it's not just an open tube in space, it's actually surrounded by muscle and tissue. And when you have anything in your neck that is swollen or out of alignment, that can actually cause pressure on the eustachian tube, which then makes that not drain properly. So the idea is the adjustments that we do will actually cause the muscles to reflexly relax. As they relax, it takes pressure out of there, and then the fluid can drain out through the eustachian tube normally. And we have a very high success rate. It's very easy and tolerable. There's really very few complications at all. I always tell patients it's best to try this first. If we can't do it, you can always go get tubes. You can always go get antibiotics after antibiotics. But wouldn't it be better to just do it naturally if you could? If you haven't considered going to a chiropractor to try this, I highly encourage you to at least check it out, see what it's about. It's all about the muscle, relaxing that muscle, letting the tubes drain the fluid out. Thanks for your attention. Dr. Mike Quast, iChiro Clinics, www.ichiroclinics.com. Thanks for your time and good luck.